So I want to thank everybody for joining Dan and I today as we sort of discuss really looking at our office workflows, efficiencies, and innovations as we're all struggling to provide care for all of our patients with limited resources and increasing demand. And I want all of our listeners to, whether you're listening live or you're watching this later, to give yourselves the opportunity to really disconnect from the hamster wheel that you're on every day and explore with us the multiple ways that we deliver care to our patients and dream about what this might look like if we were able to do this with the unlimited resources in a great environment. So thanks, Dan, for being here with us today.
You bet. Thank you.
So I want to start by everybody really thinking about how we deliver care now, right? When we talk about taking care of patients, everybody goes to the exam room, one family, one provider at a time, trying to provide care. But that is really, in fact, only a fraction of the way that we deliver care and how we serve our patients and reach them wherever they are. And so let's free ourselves. While that's an important efficiency discussion we're going to get to, let's think beyond that. And Dan, I think you and I first met back in 2004 when I struck out on my own to build my own practice. And I said, okay, I got to empower families to find information. I'm on call 365, 24 hours a day because I want to be that kind of pediatrician. And I only had 2 staff. And I said, okay, like I got to build a robust website. Like, what problem were we trying to solve when you and I had a conversation about building robust websites? Do you remember?
Oh yeah, I think what we created way back then was self-triage. It was the opportunity for parents to move to this thing called websites and to be able to look and help to understand what their child's symptoms were. What are they supposed to do at home? What are they supposed to do at night? When are they supposed to call the clinician? When are they supposed to go to the ER, etc. And that's where self-triage began, really.
Well, and you're right. And I think as families have gotten fragmented, I like my mom used to run down the street to my grandmother and say like, "What's this rash?" Right? I remember that. But families don't live like that anymore, right? They really don't, and they also want answers immediately. We're impatient. We Google, what's the latest treatment for X and expect an answer at the tip of our fingers. So
Yeah.
no wonder that today's families want that. So
Yes.
let's talk about how you make that website a care delivery model for patients that you may not even know unless you're recording how many hits, what pages you get, which is very valuable information, by the way. My
Yeah.
Tylenol Motrin dosage sheet gets hit all over internationally because it's in a usable Sue Crestley-ish language that people can understand.
That's right. So we're going to take 5 minutes out. And for some of you, this is going to seem basic, but it's very, very important. Here's the thing. Your website, your mobile website changes frequently, and it changes because of what Google does. So I'm going to walk you through a process for the next 5 minutes, and I'm going to show you what our site, my practice, Greenwood Pediatrics, is like and how it changes over time. And you might even want to pull out your mobile phone right now and go to your own practice, but I don't want you to put in your URL. I want you to put in XYZ Pediatrics. That's it, not xyzpediatrics.com, and there's a reason for that. 35 to 42% of the people who come to your website are the infrequent users. And they're the ones that are going to go to Google first and see what the answers are rather than come to your practice. And their next step is going to be pick up the phone and call the office.
Well, they're also going to search on their phone, right? They're not going to a computer.
Yep, and I'm going to show you that in just a second here. All right, so if I go to just Greenwood Pediatrics, and I apologize, this looks funny because it says greenwoodpediatrics.com, but what I did was I chose Greenwood Pediatrics, and Google creates these things called SiteLink Snippets. And you've seen these little blue links underneath your practice name. And I did all of this on mobile because more than 55 to 65% of the people who now go, as Sue said, they're going on their phone. So I wanted to show it to you in a mobile fashion. So if somebody in Denver, Colorado says, okay, I gotta go look up Greenwood, the information here, the first three snippets are information about our three offices, our Centennial, Littleton, and Parker office. There's a reason for that. We purposely did the search engine optimization so that those three would show up first, because more than 30% of the reason that people come is for a location, a map, a phone number. So you want that on top. And then using the patient portal and our pediatricians, because we want new families to be able to quickly look and see who the clinicians are. We give them contact information, but here's the thing. I missed this because I didn't go back and check our website. Our website now shows only COVID-19 information, which is important, but it no longer shows our Is Your Child Sick information. So that people who need information about what to do with their sick child, Google's not showing it anymore. So I have to go back and rearrange a few things on my site and with our SEO in order to get that to show up, so people are more likely to use that. Next slide, please. So if I click on the Centennial Office, it immediately takes me to features that are important. One, what does the building look like? You got tons of fathers who are coming to your office who they have no idea. They haven't even been there before, all right? You want to be able to give them a map and directions. So that's listed there, a little hard to see, but it's right under the picture. And then of course the address, but you want a clickable phone number under the circumstances, okay? If you scroll down further, next slide, and imagine that I'm sorry. So this slide is actually taking us to the home screen. Again, showing the three offices there and the information that people need to find in order to get a hold of us. But the second part is COVID-19 information. All right, here's where I made a mistake. I didn't go back and check my website because I need to add a second message in there of, is your child sick? And then look here, I need to give them that content so that they're finding it. Next slide.
Tell me why you pick the Is Your Child Sick? Is that one of the best tools that you give for parents to get information and self-triage? Is that why it's important on the front page?
Thank you. So Is Your Child Sick is Bart Schmidt's symptom checker. About a little over 25 years ago, I wrote a book. I worked with Bart, and we put together the first pediatric symptom checker. When websites became prevalent, Bart and I worked together on what is now the online pediatric symptom checker. And we titled it and basically registered it as Is Your Child Sick? So that's what we use, but some people just use pediatric symptom checker. Next slide. Okay, and this is just scrolling down on the page, which is really just one page screen, and you can see here that Is Your Child Sick is right here, and it is the after location and practice information and information about pediatricians, and now COVID information, it is always the next most common link used. So next slide. I think, or is that's the last, oh yeah. So if I click on Is Your Child Sick and I choose cough, this gives the patient or the parent information about cough, and it tells them what to do, when they need to call their clinician, what they can do at home, and so forth, when you need to go to the emergency room. So if you don't have content like that, you may want to think about doing that to help self-triage or let patients self-triage from home.
So I think you're empowering families, right? Because, well, if you're like my 28-year-old who doesn't like to talk to people, He only wants to text people, and he thinks everything's available online. That's how he learned how to, tie a bow tie when he had to. But in any case, you're empowering families to self-serve. The other thing that's, I think, is really important is making sure that your families know how to do this. And two ways that my practice has done this, one of which is that I've taught my triage nurses, don't just answer the question. Say to the parent, are you on your smartphone or are you in front of a computer?
Right.
Pull up Cressley Pediatrics. Look where we have that is your child sick. Put in fever. Here's what comes up. Next time, I am more than happy to answer your questions, but you don't have to wait on that triage hold for a while. There's so much information. What else are you curious about looking about it? And you're really empowering them. And then the question to me becomes, like, how many unnecessary phone calls never happened to my practice because I've empowered families with the information so that they can find it themselves. The other thing that practices have done is some practices have new patient onboarding coordinators, and as part of, what insurance do you have, et cetera, they say, let me walk you through our website so that you know how to get our portal, you know how to check your symptoms, you know how to download forms, and think about all of those questions that don't happen. You don't have time in your busy offices right now where your staff is overworked and getting emotionally exhausted to answer, my kid weighs 13 pounds, how much Tylenol? I mean, like, we have to make that available. So do you happen to know if there's any data or information out there on how many unnecessary phone calls don't happen when you build a website like this? And are there best practices for making sure your families can see the stuff? And Kimmy, you can put that slide away for us. Thanks.
I want to comment on one thing that you said, though, the onboarding folks. We have found this to be a significant and very appropriate tool. It really helps you to schedule those phone calls with people who can ask questions when you have a smaller number of calls. You don't want those kind of calls between 8 and 9 a.m. So there are systems in place. My practice uses a system where people can go and literally make an appointment to talk to that onboarding person. So data. This is a little bit old. It's pre-COVID, but we worked with Bart Schmidt to survey families who were using the websites, and particularly the Is Your Child Sick or Pediatric Symptom Checker content. And here are the numbers, and forgive me, I have to look at the numbers here. 91,
no, please do.
Yeah, 91% of parents said that the symptom checker answered their question.
Wait, 50, stop. Yeah. 91% of parents said the symptom checker answered their question. Yeah. So for those of you who are drowning in 4-hour waits for triage and quadruple calls, and if you don't have this capability, let's go talk about that efficiency, right? Yep. That just 91%, that is huge. All right, yeah. Give me the next one.
Well, so the other one is related, and that's that 53% said that it saved a call. We don't have to call the doctor's office. Now, I got my answer. Now, it's important to note that 19% said, I wasn't going to call the doctor. Now I need to call the doctor.
Wow.
I have to be concerned. And I think we should be proud of that sort of a effective means of allowing people to self-triage, because there are certain circumstances where we want them to call us. And
yeah, think about the constipated infant, right?
Yeah. Yeah.
Right, like the kid with botulism, that the grandparents is like, all babies are constipated, right? Like if it's an infant and you get there, it's like, no, please call us. This is totally Sue's right care, right place, right time. Because Bart in your symptom checker also gives people reasonable time frames, like. Yeah. Right, if things don't get better in a couple of days, like it gives them more information. That's really important. Okay, yeah. Keep going.
So just briefly, I think it's important to know that 94% of these thousands of parents who replied to this survey said that they would prefer to get the information from their pediatrician's website. They don't really want to go out to Google, but sometimes they only go to Google because they don't realize that you have this sort of information. So this may be the basic part of what we're talking about, but it really is a matter of make it easy for them to find and make sure you've told them about it and you're repeatedly telling them about it. Whether it's putting it in your office or in your exam rooms, in your waiting room, you're sending it out on your social media. You should be sending out 4 times a year on your social media little bits about fever. What do you do about fever? And get people to go back to the fever content on your site.
Yeah, I mean, I think that's why mine got to China, right? So, and internationally. But it's interesting, and people are saying, okay, I don't have an onboarding coordinator, so you're crazy. Yeah, I'm crazy, but you can do this in a different way. Make a video of you navigating and be your own onboarding coordinator. As a new parent, I want you to learn this. And then you put that video somewhere on your website and you just send people the link. You send new patients the link. People also do cool things like, if you want to see our office, here's what it looks like. Hi, Jane, there's my nurses at the, if you can see it, it reduces anxiety and people connect. There are real people on the other side that are here to help me when I need them. I will use these tools when I can self-serve and when it's convenient for me, but those are the nice people who are going to be there. If you can show them to families, it really provides them with some level of security. And you are right, we are their trusted partner in healthcare. We want them to think of us first, but it might be that they think of us first by accessing our website on our phone, not just picking up speed dial. Okay. Let's talk a little bit about the COVID symptom checker and effective and efficient triage. Clearly, we just talked about the symptom checker for general self-triage, right? But again, this is about right care, right place, right time. COVID has changed how this works, I think. And kudos for the working with me to get that COVID self-min assessment tool. Let's talk about efficiency, what COVID's changed about self-triage. And Doris, if you wouldn't mind putting in the chat for our users, if you want to play along Dan's website's COVID symptom checker, they can pretend they're a patient and do this. Let's talk about COVID changing this paradigm and this tool in particular.
So I think that we all know that COVID has changed the way we do business, and people are doing many more things online. And it's important that we adapt and make sure that we're providing the opportunity to self-triage with COVID. And so Sue reached out to me a couple of months ago and said, hey, Bluefish Pediatrics has put together this awesome self-assessment tool, and kudos to them in Houston, Texas. And so we were able to take it and adapt it to where people could put it on their website and they could adapt the local content. Like, where do I go and get my COVID test? Where do I go for test or my COVID vaccine, et cetera?
Or what do you do at Cressley Pediatrics if you need a return to school note? And by the way, guys, with Omicron, you and I were scared about, like, how long is this tool going to be useful? I think it's going to be useful all winter. So if you have not yet adapted yourself and adopted this tool, reach out to Dan.
Yeah, and I think that this is just a picture of how it starts. It basically is an algorithm, and it's fairly easy to do. It's set up to work for mobile specifically, and that's the photo that you're seeing. Right now, there are about 130, not about, there are 130 practices who are now using this self-assessment tool, and I don't have the most recent data, but we're up to 27,000 people who have used it so far. And I think that if we looked over the last couple of weeks, that's going to increase. Now, there's some other data that you need to know. Of those 130 practices, some of them are marketing it significantly and getting very high usage. There are others who are only getting about 10 to 20 visits because they put it on the wrong page, they aren't telling their people about it, etc. So The numbers are a little bit deceiving. There certainly can be a lot more people using this tool.
Well, and again, this points out the whole thing that if you're putting information out there, your patients need to know that you are, right? Like this to me is a social media blast or a mass email. You may not have a COVID exposure today, but sometime in the next month, someone in your family might. Please use this tool so that you know exactly where to get the most appropriate care. And when your family's calling and ask questions, I need a COVID test. Send them the link, send them a portal link, do whatever you need to do, but it's not good enough to just stick it there. It has to be, you have to market it almost. You have to use marketing strategy to push information. And remember that most families, it's interesting, you said you have infrequent users. People only go there when they need you, right? Like we live in healthcare. So we think everybody's Googling us every day. I don't think so. But when they need us, it's like that trusted friend, right? Like you want to be there when they need you, but if they don't know where to look, it doesn't do you any good. Yep. So let's talk about other ways that COVID has changed the way we do, and you can take that down, Kimmy. Thank you. The way that we are serving families, triaging in new and innovative ways, some of which were on my first slide.
Yeah, so I think in terms of the self-triage, that's obvious, and we spent some time dealing with that. The second part is self-scheduling, whether or not people can have systems on your website to self-schedule. And there are lots of applications for that. There are a lot of things through OP where people can do some self-scheduling per se.
Yeah, so I want to interrupt you for a second because at least half of our audience is going to be like, okay, Sue, here you go again. I can see the millions of things that will go wrong when we let people self-schedule. They will schedule their well visit before it's 365 days. They'll mess it up. And my answer to that is, yeah, it's not perfect, but you don't have staff to even take the calls. I think it's better to let it happen and figure out and deal with those things. Sometimes people misschedule it, your staff does it, right? There's going to be errors. We have to give each other kindness and grace and have someone look at your schedule and try to troubleshoot it. And sometimes, but would you rather deal with, hundreds of unnecessary phone calls for a COVID clinic or a couple of things that you have to pivot? What happens when we don't self-schedule? Oh, Johnny had a soccer game, so I brought Jimmy instead. Can you give him his shot while he's here? It's like, what are you going to say? No, right? Yeah. The right answer is you take care of the kids the best that you can. Has your practice started using some kind of self-scheduling for COVID clinics, well visits, sick visits?
We don't at this point in time. We've got that capability, but we're not using it right now.
Yeah, see, so beware. Dan and I talk a lot, but we're not always the first adopters of all of these new technologies. We just see the power, but we also have our own practice teams that are going like, we're done, no more innovation, please don't hit us, right? Right, it's true, right? Like everybody's like, come on, Sue, could you try this out on somebody else instead of me? But I will just tell you, there are ways to dip your toe in the water, right? For Cressley Pediatrics, and this goes back, when was H1N1? Do you remember? I don't remember. H1N1, I looked at Greg and said, oh, I am not handling hundreds of phone calls to get H1N1. You got to build me something where patients can schedule them something. And that's where the first flu clinic scheduling happened, because I was like not going to do that without that help. And since then, my practice has embraced vaccine clinic scheduling. So I think that's a no-brainer in some ways, just to reduce the churn. There are ways to dip your toe in the water and say, I only want to do one doctor, sick visits to see how it goes, right? And I would say, do that, learn from it, then tweak it. The 365 days a year checkup thing is not as big as an issue as it used to, because most payers are going to a calendar year. So if you're still under the misconception that every older kid has to have a well visit that's 365 days apart, check with your payer. You may be mistaken and it's folklore. And if not, please contact me at the payer advocacy and I'll work with you to fix that, because
And
most
Sue,
of the payers are getting rid of them.
I want to support what you said about taking things like vaccine clinics, whether it's COVID-19 or flu clinics, schedule those. Greenwood does use scheduling software for that specifically. We literally signed up or put out our flu clinics, and within 1 hour, all 1,200 slots were filled up using the software. And so, same thing with COVID. Big things like that, you don't want people coming and calling your office. You want some simple software where they can sign up for that.
And it's a worthwhile investment from my perspective. Again, you can then, keep your staff from being overwhelmed and exhausted. So you said something to me about business interactions and how COVID has changed from more to more digital. Can you
Yeah.
give me some more data or statistics about how COVID has flipped things to a digital narrative?
Well, I think we intuitively we know that business has changed dramatically, and everybody's working remotely from home. Same thing, the parents are working remotely from home, and they're taking a little break, and they're already at their computer, so they're looking for us to provide more digital capabilities. And it's important for us to begin to think about what we've done so far and what do we need to change. We need to take things like that self-scheduling. We need to listen to our phone triage, IVR. If you haven't listened to that in the last 3 months, it's probably outdated. And you need to take a look and figure out how you're going to do that. You might have to recheck your system for what you're doing with your phone and nurse triage
Well,
group.
and put your
Because
COVID symptom checker, the first thing they hear, if you're calling for COVID symptoms or
that's
testing or vaccine, go to our
exact,
website and
that's what
I,
should be in your phone tree.
yep.
Exactly. Yeah.
So let's talk a little bit more about some efficiency triage tools. Thinking about, Amazon, I get that chat bot and it's not so annoying because I think it gets escalated to real people at some point. Do you think that we're eventually heading there in triage? I mean, we know that your most time intensive staff time is one phone call with one parent at a time. Those phone calls can last anywhere from 2 to 15 minutes. You can't scale yourself out of that, people. You
Yeah.
can't. But people who are doing chats, right? Like, do you think at some point we're moving to interactive texting? I know some practices are doing it, chatbots, etc. Tell me what you think about that.
It's on the way. There are a number of companies that are doing it. We're going to see here in the next year to two where, frankly, your website is going to become more important, and your patient portal is going to become more important because people will want to chat. They'll want to have a real-time interaction, and for basic things, you'll use the opportunity to divide them up into sectors where appointments might be a live chat, nurse triage might be a whole different thing, but requesting a prescription, frankly, can be an AI sort of a thing. Referrals can be AI, where somebody can respond to that later, and that's underway right now. We're going to be taking the self-assessment tool and adapting that so that people will be able to go through self-assessment for fever and for croup and for major
Yeah,
things like
you and I, when we started working on them, like, oh, this is the beginning of a door here, Dan, because
it.
I see taking all of Bart's content and start making those sort of interacted checking, because it's the decision tree thing, right? And it's not really any different than if practices use clear triage for or Bart's books for their triage protocols. It's just a parent version of them, so that when they get to the right part of the decision tree, we can funnel them. You need an appointment within the next 12 hours. Here, would you like to self-schedule, or click a button to connect, or click another button to chat to make the appointment? Like, if we do that, we have digitally native families, right? This isn't the Medicare population who's struggling. We have a way to serve families in powerful ways if we're smart and we pick good partners and we innovate around that.
Sue and I have talked about queuing theory, and queuing theory is essentially a math problem that they give to every first year math student in college. And it basically says if you have X number of customers showing up in an hour at the grocery store, and if you only have one checker, how long is the fifth person going to have to wait in line? And the answer actually is about 25 minutes. But if businesses can use queuing theory and they can look at the volume of calls coming in the first hour, which is when all of us get that dozens and dozens. At Greenwood, we get 300 phone calls in the first hour. You can't possibly answer all of those phone calls. And what you have to do is the same thing that the grocery stores do. And they open up more lines at that point because they've cross-trained their employees to come in and check people out. We need to be able to cross-train employees to be able to have them come in and do 3, 4, 5, 6 appointments in that first hour. So that's something that we can do right now.
Well,
Down the road, what's going to happen?
Hang on a second. I want to tag on there two things that you said, and it is not intuitive that fifth person waits, but there are math, and I'm happy to share the articles. It's pretty brilliant, right? But this doesn't just apply to triaging phone calls, right? It's anytime you have a backup anywhere, right? It concatenates. Think Lucy in the Chocolate Factory, and by the third person, she's sticking it in her, she's eating them and doing whatever the heck she can. But it sometimes only takes somebody to take the little bit of edge off till you get back to nothing. Think about the grocery store, right? You have somebody watching. As soon as most smart grocery stores, first of all, they have self-checkout. They have 15 or less, which just tells you that not everybody needs the same 15-minute appointment, right? Like, let's figure out how to scale. Some people need 5, some people need 35, right? But they know if they pull somebody else from somewhere else and just see 3 customers, it's back to a shorter wait, and you're not constantly trying to big that wait. And so I think that you're smart there in that cross-training piece of that, but I think that applies to providers too, right?
Yes.
Like if you have somebody else who is, sort of booked as your emergency backup person, they slide and take they can even take phone calls, right? Like we can schedule appointments. If we can manage meningitis, we can schedule follow-up appointments while the patient's in the room with us. It's ridiculous to then hand it off to another place. But the other thing that I did, because I didn't want 300 phone calls in the is my answering tree says, if you would like an appointment for the next day, leave a message with details where you can be reached between 7 and 8, and our staff will call you. So I taught parents as onboarding, if you're up in the middle of the night at 2 in the morning, you don't have to wait till try to drive through. Call me and leave me a message at 7 in the morning. And I have a staff person that comes in before we open triage lines and calls those people back. That was an easy pop-off valve that somebody can implement now. Sorry, I interrupted you.
Yeah, no, and I'll just add to that so that as we move into chatbots on our website to do some of that scheduling through AI, there are other advantages. So if that person is waiting and they've complained that their child has croup, the chatbot allows us to intelligently say, while you're waiting for someone to come, here's the link to the article about croup on this website. So there are some advantages to digital that I think we are just beginning to see.
I think you're right. And technology, and we as innovators, and please as the pediatric community, help us drive this so we're solving our problems. People aren't just inventing stuff and trying to, give it to us. Let's drive where this is going. I've said on a previous webinar, what if you were standing in line on hold waiting for triage, and some chatbot or something and said, I noticed you're coming from this number. It's are you calling about Johnny or Jimmy? Jimmy. Could you tell me something about what you're calling, and whether it's voice activated or chatbot? Oh, Jimmy's constipated. May I text you the link to our our website, and then you don't have to wait on hold. And if you get to the point where you need an appointment, here's the self-scheduling link, here's the portal link to send us a message, what have you. I think people are still stuck a little bit in the fee-for-service model of, we only get paid if we see patients, so we're going to bring everybody in. You can't, we don't have a predictable volume, at least for the foreseeable future. So if you're still stuck in the every patient calls gets an appointment, there are people who need you you're not seeing, and they're going elsewhere. Let's talk a little bit about the changes that COVID's brought to our competition, Dan. And if we don't innovate, they're going to.
That's right. So right now we're dealing with a lot of changes over the last 5 years. Not only do we have more non-pediatric urgent cares, not only do we have additional therapists like chiropractors, etc., who would love to see our patients and treat them for COVID, hint, hint. Or we have the local grocery store that now is providing some services that we used to provide by ourselves. And then, of course, we have everybody on Google who's trying to compete for what we can do. So the competition has become extremely increased, and we have to step up and respond to that.
Yeah, and I think that's by creating relationships with families, letting them know we're partners in care, showing them that you're tools, but then being available to see the kids who really need to see you, but empowering families to be able to care for themselves if they don't need that appointment. And we have created whiplash and weird expectations for our families, right? Like if there's holes in your schedule and a kid calls for pink eye, it's like, oh, we can see you at 2:30. And the mom's like, I got to get a kid off the bus and whatever. And then it's like, oh God, we're booked. Pink eye, we'll call something in. You can't go back and forth, right? You have to decide what is the most appropriate care. And I would argue with protocols, pink eye can be safely treated over the phone or a telehealth visit with a prescription. If you have a relationship with the family and you say to them clearly, if you do not get better or there is eye pain, I need to hear from you and here's why. If we educate them along with that, they will engage with us and use our tools. So
one thing, can I add one more thing? And I think
absolutely
that when we focus on trying to be patient-centered, I think it's important to create KPIs, key performance indicators, for specific parts of your practice that identify what's the service level that we're going to provide. So an example of that would be, what is your KPI for how quickly you're going to answer the phone? And if you decide that it's going to be 4 minutes or it's going to be 10 minutes, your decision on how you answer that problem is different at 10 minutes than it is at 4 minutes. And if you say we want to try really hard because our patients deserve to get the phone answered within 4 minutes, then that might be a different answer. It's a different target for you to hit. And so I think that creating KPIs for phone and for appointments, etc., help you to identify how you're going to solve that problem. How are you going to get down to 4 minutes?
And you don't know what you don't know. Your people may be waiting 25 minutes and you have no idea, right? But I will just tell you, 4 minutes is about as long as people will wait unless you're checking in on them. It's if in 4 minutes, if you're not there, if you can do like the ERs do, which is there are 6 people in front of you and we expect you to wait, another 10 minutes, go make your other cup of coffee while you're holding. It's true in our offices. Patients start to open the door and look out if it's too long since someone touched them. And it's true in telehealth. So people should understand people are patient for about 4 minutes unless they can see where they are in their queue. and otherwise have reminders about checking in on making sure where they are in that
At the
patient.
grocery store, we all do this. We walk down the aisle on
Oh, I
busy
picked the wrong
days.
line.
We
I
look and
picked
we
the wrong
say,
line.
yeah, how much do they have in their cart? All right. Well, they have a lot in their cart. I'm going to go to the next one. You can't do that on the phone.
I
But what
can't do it in
you can
person. So
check check with your phone company. You should be able to go online and be able to look and see when are the most phone calls coming in, when are our busy times. You can actually see it in real time for some symptoms. Many of you know Polly Ventieri, and Polly is our chief financial officer at Greenwood Pediatrics, and he has threatened to put a screen above the scheduler so that it will show here's how many patients are waiting on hold. And that's important information to have.
well, even just to scale your resources, right?
Mm-hmm.
So that you can tell where there is. So I'm going to switch gears for a second because I was recently at a telehealth summit where the focus was on health equity and technology. And it was a really interesting conversation. And what they said was, if we, just like you built the website mobile first, if we don't build technology and innovation with health care access and disparities first, we may actually be making healthcare disparities worse because we are giving the people who already have access better access, but the people who can't find a way to access the tools are even more left out in the cold. Tell me
Yeah.
what you think about that, and what should you and I and our colleagues as pediatric, innovators and pushers think about this?
I think it is certainly a danger. And I love the concept of thinking about it first. Um, People have often heard me talk about people who have Medicaid who come to our office. Um, yeah, they're not paying a copay, but they're paying a lot if they have an hourly wage and they need to take 3 hours off in something that we could have done in 30 minutes. And so we need to be respectful of those kinds of needs. It does mean that while we have all of this wonderful digital stuff that we want to do, some people aren't going to have the right phone to do telehealth. They're not going to have adequate Wi-Fi, etc. And in fact, we're going to have to provide more choices in order to provide health equity. And those choices sometimes mean that you have to have a real live person at times under the
Yeah,
circumstances.
and I think we have to be better about health literacy and technology literacy. And maybe we can find somebody, some technology company, to figure out how to do telehealth that doesn't take as much bandwidth and doesn't use data minutes and is easier to do. Or we do, use libraries as the access point. I mean, I feel like everywhere that there is an AED now, right? There should be a quick telehealth place so that everybody has access. We have to go to where the patients are. So we're not going to solve that, but as you solve problems in your office, please be cognizant of there are people who are struggling to access you. And they may be the people who need the person-to-person contact the most, and make sure that they're getting equal play.
Yeah.
So I want to move on to my lean brain. My father was an engineer, and I am not lean trained, but it's in my DNA. When I was a kid and I was sweeping the front walk after he mowed the grass, he came out and told me I was inefficient because I was sweeping in one direction, right to left, to get the grass off the walk. He's like, Sue, that's wasted energy. You should be sweeping both ways when you go down the walk. And I'm like, okay, Dad, but I think it's stuck with me. Clearly, with our current resources, staff, overburdened teams, we can't afford to waste any motion or energy. Is there any low-hanging fruit that our listeners can use from your perspective to eliminate churn and unnecessary work and take care of patients more efficiently?
Yeah. Um, so I think the first thing is that we have to all adopt a culture of ask for help, call for help.
I'm
And if
drowning.
Yeah, if we haven't set that code word or that capability for people to be able to give their little SOS, I think people will just continue to drown. Secondly, and we certainly have seen this in my practice, is that we perhaps weren't as sensitive and we weren't tracking how hard our nurses were working as we added this and that and this and that onto their workload. And at some point in time, there's only so much you can do in a nursing position or in a front desk position. So we need to listen and understand first what's overloading them. The second thing is, as we've already said, you have to get data. You have to look at your website and how many people are visiting it. I can tell you right now that Greenwood Pediatrics has had 3 times the number of visits in the last 3 months than we've had in the last year. The volume on our website has been remarkable. The volume of phone calls is also coincidentally 3 times as much. We have a ton more phone calls coming in. So you need to know what they are, how often they're coming in, what's the rate, and how many calls drop off. We have a pediatric practice who came to us and said, our data shows that 70% of our phone calls are dropping off. People are leaving. The wait
Oh my
time.
God, it's like the ER left without being seen.
Yeah, and so basically we help them set up a phone triage system whereby we have additional agents answering phone calls in an hour to 2 hour span of time so that they don't have to hire a gazillion people to take care of that first hour or two. And it's worked out wonderfully under the circumstances. I think the other low hanging fruit is what we said. You have to educate your parents. You have to ask them to help you. You have to send out on your social media, yeah, we're shorthanded. Yeah, the calls are overloaded. Here are some things that you could do to help us. Like if you need to make a well visit, do it after 9:30, please. So you have to cross
Or
train
send us a portal message.
or send us a portal message. Yeah, exactly. Sue, you and I have talked about, we have to think about how we do more telehealth. And
Yep.
is that somebody that is going to sit at home, not take up office space, but it's going to be somebody from home who essentially is a telehealth nurse practitioner for that pink eye, those asthma rechecks, those mild symptoms that we might still provide advice for, but we also can get paid for that.
And we
And,
don't want to send them to urgent care if we can
and,
help it.
and I also want to say that we've said in our office, and some of my partners uh, repeatedly suggest that we spend too much time with our nurse triage. Sometimes we just need to make appointments, and it isn't worthwhile to go through so much nurse triage when clearly the child needs to be seen, and just
Yeah,
book an appointment.
that's why I like getting to the point where you can do self-assessment and then self-schedule, right? That eliminates that whole churn, like assess, and if it gets to the point where you need an appointment, then click here to self-schedule your appointment. I think that takes the load off.
I would say
So
that one other low-hanging fruit, if I could just add that, and this is just comes from my heart. Um, I think all of us clinicians and leadership in pediatric practices need to set a KPI for charting at home. And I think that the answer would be, how do we do something and not chart at home? What do we need to do? That's a problem that we all need to solve so that our staff is not overloaded, because they're overloaded during the day, and at least in my practice, more charting is being done at home. And one of our KPIs is, how are we going to stop that? How are we
yeah,
going to
let's get together on a future webinar and figure that out, because I've got some ideas. Kimmy, do we have any questions from our attendees, or Dan and I going to just keep innovating together?
So we had a few questions come in. A bunch of them were very similar. So I will run through maybe 1 or 2 of them. Before I do that, though, I do want to remind everyone on the line that by the end of this week, everyone that is in attendance will be receiving an email with a copy of the presentation, the webinar recording, and a CEU certificate. When you close out of today's event, you will see a brief survey pop up. We're asking that you just take a minute to provide your feedback on today's event in that survey. So, questions that we got in. One was, is there a way to incorporate the Barton Schmidt pediatric telephone protocols in the practice website?
Those are already available. We've got 3,000 or 4,000 pediatricians that use it. I don't know if I can say go to remedyconnect.com and we can make that content available for any website. You don't have to be a Remedy Connect client.
There you go. If somebody wants to put remedyconnect.com, Doris in the chat for people. If you go there, Dan's team will help you out.
You can also include it in the follow-up email as well. Is the Bart Schmidt symptom checker the same platform that the AAP uses for their symptom checker?
Yes, it is the same platform, and it is divided up a little bit differently in terms of how it's done. We provide the Bart Schmidt content and also all of the other AAP content. So we actually have about 1,500 articles that are provided for people who want that. One of the things that you have to understand is that it's very difficult with some third-party providers of content for you to be able to label this as content that is on your website. And so we worked really hard to make sure that your logo and so forth is identified on that content so that if they print it out, they know that it's coming from you. And that's something that you have to think about.
Someone is asking what chatbot service to use.
I'm not using it yet, but go for it.
Sue and I are going to work on this, okay? So I think she wants to invite me to Jamaica for 3 weeks, and we're going to solve this problem. It's already underway, and we're developing those processes, etc., to make it work, and it'll start along the lines of the self-assessment tool and be pretty simple and straightforward, and it will expand from there using artificial intelligence and machine learning. It's amazing. It's really incredible.
Dan and I are a commitment to doing this safely, right? Like there is no way I want people out there using something where somebody, you know, it's the first do no harm physician principle, right? And so we think it's just evolving technology and nobody's really put pediatric attention to it. And we'll work on it, but I don't think it's there. I do think that there are ways to use chat services with your team, your practice team, or secure text that people are using through some third-party applications. I'm not personally doing it, but I think, you know, again, as a test pilot, those are things that people are trying to be able to be more efficient.
And keep in mind that, and again, conflict of interest because I'm with Remedy Connect, but we created these things for pediatricians. And the website is going to become even more important as you have a huge library of content. Every time that you work with a patient, they're able to go back and be able to refer to content. Our telehealth platform allows us to send articles to people with links specifically about the issue that you're dealing with. So if it's group, there's a link that goes back out to the patient after the visit that sends them back to your website. Whether it's our social media or our telehealth or whatever, the chatbots, we want all of that coming back to this hub of information.
And that's very important. If we're going to be the trusted partner for our families, we need to be speaking with one voice and sending them back to one place. I also think that we need to be talking about how we deliver content. People don't want to read long articles anymore. In my head, and at the academy, I'm gonna, you know, will be hard to convince of this, But man, I would love to do anticipatory guidance in little short videos or Vimeos, and like car seat safety, and it automatically knows that your kid's an infant. So it just gives you that section. And then when your kid becomes, you can turn around, congratulations, your child is old enough to graduate to the whatever, right? I mean, there's just so much that's possible as technology is evolving to give really directed content with your voice and your brand so that you become, and I don't think it's a website anymore, Dan. I think it is your digital front door to your practice.
Yes, exactly. Very good. Exactly.
Anything else, Kimmy, or are we out of time?
I can throw one more at your
Go
way.
for it.
Okay. In our market, telehealth reimbursement is now lower and every state is enforcing different rules. So we've cooled off. What are other markets seeing?
So it's all over the place. I would say join your state medical society and your AAP chapter in advocating for fair and appropriate and equal payment. We are trying, now I'm wearing my payer advocacy at the Academy hat. We are making the case that this is different for children. When you have an adult on the other side of a telehealth visit and you can say, raise your hand, does that hurt? It is way less complex than if you are trying to have a parent deal with the kid, get in a different room, etc. So please join the advocacy campaign to do that. But I'm going to tell you, I would not abandon telehealth. It is not the spare tire you only drive on for 35 miles. Your families will find other places to get it. Children's hospitals are setting up pediatric specific telehealth urgent care to poach your patients. If you don't find a way to provide that service and find a way to do it efficiently, so even if it doesn't pay you as much, you're still getting access to care of your patients in a way that when we move to value-based payment long after I'm retired forever, but we're on the journey, that it doesn't matter. You only care about giving the patient the right care at the right place at the right time, and collectively the payment model works. All right. Thanks so much, Dan. This is fun.
Yeah, thanks. Appreciate everybody's time. Thank you.
Yes, thank you both, Dr. Kressley and Dr. Fighton, for sharing your expertise with us today, as well as all of the attendees that we have out there.
Yeah, and it's been my pleasure. Thank you for taking time out of your busy day, caring for patients and families, and thank you for everything that you're doing to serve the families of your communities. It's our pleasure to keep engaging with us. Find us on social media, email us. Dan and I are easy to find. Use resources. Office Practicum has efficiency resources and ways to track KPIs in your practice team. You'll get a survey after this webinar. If you want to, please indicate that on the survey and someone will be in touch. Thanks so much, and stay safe out there.
Take care. Bye-bye.